So, welcome if you're still here. Those that want a bit more detail on the Czech Republic, Pavel's going to give us a bit of a presentation now. So, Pavel, over to you. Thank you very much.
Okay, thank you very much, Dr. John, for inviting me to your channel. So I would like to speak about the situation in Czech Republic and how we did it in the Czech way. So here in the middle of the Europe, you see the black dot, it's the Czech Republic. So we are the worst in COVID just now with daily 15K confirmed cases today.
And that's the lot because it's only 10.7 population, Pavel, isn't it? 10.7 million.
Yeah, that's right, yes.
Yeah.
So if I go briefly through the epidemic outbreak, so in January it was nothing here. We have only very mild preventive measures like check at airports. In February, the government still not considers that COVID is some threat, and people went to Italy for skiing and brought the infection to the country. In March, we had the first three cases. So officially, the outbreak started. And what is quite interesting that the March 9, the man with the Excel table, which we know that it's an insurance company director, came to the ministry, came to the government with he made some basic exponential model in Excel. And of course, nobody believed that this is true. But the prime minister took the slide, took his numbers, and checked the numbers and cases the next days, and he saw that he was right. So then it went very fast. Since March 11, we went into emergency situation. Everything not let's say essential was closed. So we were onto very big lockdown. Then in the April, low outbreak was considered as mild, and the government started to slowly release the measures. In May, there were some further releases, and the emergency situation was also released. In the end of the May, the man with the Excel table warned again, and also others, some experts like data experts, and they proposed the recommendation for the second wave, for example, the update pandemic plan, which is quite old, and mainly to increase the tracing and testing capabilities, which we will see that later failed. So the Czech way that apparently nobody listened to this. Then in the summer, we were wearing no mask. It was released as well, and the prime minister said that we are just prepared for the second wave and there will be no further measures. Of course, the cases were slowly growing, and it's completely crazy. You can see a Charles Bridge here, very old bridge, 500 meters long. And in June, there was organized a so-called coronavirus farewell party.
Farewell party, yeah.
Farewell party.
Yeah.
And they reserved 2,000 seats there, and the people were just there, sitting and eating and like this. So people just started to think like there is no virus anymore. Government asked people to spend holidays in Czech to support the economy and as well to not bring the virus from outside. But even the prime minister was abroad, was in Crete and so on. A lot of people as well. So probably they took the virus back to the Czech Republic. I don't know, but it's likely. And then in July, the officials says the numbers are growing, okay, but everything is fine. It's not the second wave. We just do more tests. So it was in the summer. And then in the August, the cases, of course, were still growing, but everyone was just happy. I have to say that there were a few experts and scientists in the public space which raise hands and say that there is a problem, the virus is still there. But also there was a lot of disinformation circulating around and some hoaxes that COVID is fake and so on. And unfortunately, some publicly visible doctors in TV, in the shows, one of his dentists, the second heart surgeon, oncologist, they were just saying that the situation is not bad and they were making light of the situation. So here is the number of cases. So in the spring, it was really nothing, like very small wave. And then during the summer, everyone was just happy. The government sleeping, I would say. And approximately at this moment, the experts were warning because there was already exponential trend, but the number of cases were so slow that it was probably not visible to most of the people, and we are just now here. So in the August, there were some worries in the public space. So the masks started to be mandatory at the airport and recommended in schools, not mandatory but recommended. So in September 1, the schools were opened with no masks. In most of the schools, there were no masks. Then there was elections, and after the elections, the situation started to accelerate. Let's say the masks were now mandatory inside, and the testing and tracing system collapsed. Yeah. So then very quickly, universities went online. And September 30, the emergency situation was announced. In the October, again, the group of the people, dentist, heart surgeon, and some others, sent open letter to government. Please don't do further restrictions. They are worse than the coronavirus itself, and so on. And then again, it went quite fast. So closing of swimming pool zones and so on, restaurants closing at evening, and in the October 12th, all schools have to be closed except the nursery schools, and the restaurants too. They can have now, let's say, the open window for selling the food. And October 15, the Prime Minister says that the situation is catastrophic. We have now around 30% of positive tests, which of course means that the viral load in the society is extremely high. And and finally, it's completely crazy to me. In October 18, there was a demonstration protest and the government restrictions. So, for example, you can see that there is a scaremongering with COVID, freedom or death, stop doing experiments on people and so on.
Yeah.
People are not wearing the masks properly as a protest. You see that.
Yeah.
It's not actually a mask.
Yeah.
And it went completely wrong later on. So that was the demonstration. A lot of people, you can see, several hundred of people there. And now, if we continue, the October 22, just a few days ago, we are under partial lockdown. All non-essential shops and services are closed. You can go to work for food, pharmacy, visit relatives, and so on, but it's recommended to stay home most of the time, go home office, and so on. But there is no reinforcement, in fact, no police control. There is a police control if you are wearing masks. Sometimes you can there is a fine for this, but just this. Mm-hmm. A lot of people in the hospitals are going into problems because a lot of medical staff is sick, and the hospitals are running out of the capacity. Yeah, you can see some prediction. This is the source by Ministry of Health just a few days ago. This is standard capacity of beds. Then the capacity of bed increased to approximately 15,000. And there is a predictions with the reproductive number 1.4. As I look today, it could be a little bit less, like 1.3, but it's still quite high. So approximately in, let's say, 2 weeks, we are at this point. So we run out of the capacity of the beds.
And I think Pavel, with the 30% testing, 30% positive tests, that means there's a huge amount of community transmission going on now.
Exactly, yes.
So with that very high level of positive tests, I'm afraid I would say that this great increase in cases is completely inevitable now.
Mm-hmm. Thank you for pointing.
The people that are getting infected now are going to be getting ill in about 6 days' time. And a week or two after that, a good proportion of them are going to be getting very ill.
Yeah.
And it does look like that's going to exceed the ability of the healthcare system to cope with it on that current graph.
Yeah. So it's I think it's definite that it's clear that there will be some serious problems and we will run out of the capacity.
Yes.
Some
Yeah.
people are saying this in Czech Republic. For Professor Fleger, for example, he's a professor of parasitology. He's sometimes you can see him in TV, and he's predicting the situation, let's say 1 month or 2 months ago. So
And what this actually means is if there's more people sick than there is hospital capacity, it means the infection fatality rate will rise.
yeah, that's it. Like
And
we saw
people who otherwise would have survived with some medical interventions may not get that intervention.
We see this, I think, in New York and in Italy in March.
For a short time, yeah, yes, it's true. And of course, the other thing is that people with other conditions like cancers and people that need routine surgeries aren't going to get treatment, and that can cause more deaths as well.
That's right. That's kind of frightening. Yeah.
Yeah. Yeah.
Okay, so that's the situation. So one hospital is being built, and second is planned, and also some staff and doctors from European Union is going to help and like this.
Good.
Okay, so if you make just simple exponential fit to the data, you see that we could knew that the situation is bad 1, 2, 3 months maybe ago. So if you look here at the timeline and the number of hospitalized, and you plot the data and you do just a simple exponential model, which can
But basically it's a straight line on a logarithmic graph, Pavel.
Yeah, thanks you for pointing this. This is a logarithmic scale of number of hospitals.
And it's a straight line.
It's straight line, so it's exponential actually.
Absolutely, yeah. And I think people need to look at those numbers up at the left and see how rapidly that is increasing.
Yeah, some people don't understand this kind of graphs because they just doesn't see that it's compressing. But it's exponential. Yeah, that's it.
Yeah. So the data on the right and the data on the left is both the same, essentially the same data, isn't it?
No, the data on the right is cumulative number of deaths.
Oh, sorry, that's cumulative number, yeah.
Which also grows, let's say the number of deaths per day is exponential, but finally this is exponential as well. Yeah, so you can expect what's going on. Maybe there will be some flattening of the curve. I don't know. Of course, this is simple model. If the restriction was working, I don't know.
So the hospitalization cases will run out around about the 14 to 16,000 level.
Yeah, 15,000, 15K. Yeah.
And that's predicted for November the 6th.
Yeah.
Got it.
Okay, so.
Yeah, got it.
So, and now we have a political twist now. So the epidemic is not just a problem of the virus, but of course of the politicians. So you can see here the Ministry of Health, Professor Primula, who was caught leaving the restaurant, which it should be closed by his orders.
Yeah. We've had similar problems in the UK.
Yeah.
Yeah.
He says that he had just a private meeting there, but he has his own office. I don't know what is going on, but it's not
good, does it? Not a good look.
Not good look. He's a professor of epidemiology, so I think he's the man at the right place, or he was. So now he's going to be replaced next week, but definitely it's not good sign for the society, because you know that at least 10 people of percent of population is not following the rules here, and when they see this, they I now read in the Facebook that the people from the restaurants are saying, okay, we are going to open as well, and so on. So it's not good.
Leaders need to lead by example, don't they?
Exactly. That's it. That's it. Okay, so this is the current situation. And this is the situation from today on a street market in Prague.
That's today.
That's today.
Wow.
The people have masks. Yeah, they have masks, but the concentration of people there is crazy.
Just put that together, Pavel, with 30% testing positive.
Mm-hmm.
And it just doesn't. The numbers don't bear thinking about, do they?
Yeah, that's it. Yeah. So yeah, this is definitely a problem, but it's open. If you keep the distancing and all these rules, yeah, you can be there. So that's it.
Yep.
And okay, so I think this is the last slide because the Czech way is also about the strong sense of humor.
Yeah.
I think like in the UK, so we share kind of similar, I think, sense of humor.
Yeah.
Just immediately after the affair of with the Ministry of Health, this appeared in the social media. So
Yeah.
not to end, just to end with some fun in this situation.
Absolutely. Pavel, fascinating presentation. Thank you very much.
Thank you very much. Thank you.
Everyone can learn from this situation, I think.
Yeah.
Just one thing I'm curious about, the man with the Excel table, who was he?
It was a director of insurance company. And
Really? So this is just an ordinary man who said, just a minute, we've got a problem here.
it is ordinary man, but he had some contacts with politics, of course. So it was quite easy for him to give the data to the politics.
I see.
But it's right, the insurance company, it has a lot to do with prediction of epidemiology and so on.
Of course,
So
good point.
right,
Yeah, good point. Yeah.
Hmm.
Pavel, we wish you well, and we wish everyone in the Czech Republic well over what's going to be a difficult time. And thank you for all that, for sharing all that. We really appreciate it.
Thank you very much for
Thank
inviting
you.
me.
Yeah. Bless you all. Yeah.